And I'm Rima, I'm also first year at Birmingham.
Brilliant. So if we start to begin, and the people asking about recordings, yes, they are recorded and they all get uploaded to YouTube after the sessions. So if we start with that, and this is where the recordings will be uploaded. It's on the chat. So yeah, whenever you guys are ready, let's go for it.
Mhm. Okay, so hopefully by the end of the session, you guys would have a better understanding of what the University of Birmingham has to offer when it comes to medicine. And I'm assuming you've all applied to University of Birmingham as well, so you clearly had a good impression, so hopefully you get a bit more of insight now that us two obviously were at first year, so we've kind of gone through the process and we've formed our own impressions now that we've started and finished our first term. So hopefully this should help as well with your why medicine, I mean, sorry, why Birmingham questions within your interviews. And I believe Birmingham interviews are starting this month anyway, so this should be hopefully very relevant for all of you. So, Alicia, do you want to go over what we're going to discuss today?
Yeah, sure. Firstly, we'll be going over a bit about medicine at Birmingham, what the course is like, how it's taught, and some other opportunities that are available at Birmingham academically. Then we'll be going over medicine interviews, kind of the format of what the interviews are like, and tips that we have. Then thirdly, we'll be doing some practice MMI scenarios. So hopefully we'll be getting some volunteers for those. If you guys are happy to do that, that'd be brilliant. Um, then fourth, we'll be going over life at Birmingham, a bit about what the accommodation is like, what the city itself is like. Since a lot of people will be moving out for the first time, it might be nice to know what Birmingham is like as a city. And then fifth, we'll be going over any questions that you guys want to ask, and we'll be happy to answer. So, yeah.
Mhm. And also, if at any point you need something clarifying or if a question pops up, feel free to put it in the chat. And either we will answer like as we go along, or maybe just towards the end during the Q&A session. So, in terms of medicine at Birmingham, it is a 5-year course, and we split it up into 3 phases. So, for the first phase is year one and year two. And essentially, there's 4 foundation modules. So in first year, you have 2 foundations. So foundation one is term one, and foundation two is term two. And then it carries on into second year as well. So you have foundations three and four in second year. And each term you cover around 4 components. So these can range from your biochemistry, which is very similar to A-level biology and chemistry combined. So your protein structure and cell membranes, the best part of A-level biology. No. So all of those will be covered pretty early on within semester one, as well as endocrinology and pharmacology. Pharmacology is quite different. It's probably something that you may expect to be taught at medicine, I mean, at medical school, but you wouldn't have really come across anything like that before. It's all your drugs and interactions and all of that. There's neurons, and something specific about Birmingham is the fact that every week you have a day that's allocated to sociology style studies. So that's your, and Alicia will be talking about year two.
Yeah, year two is quite similar to year one. We've just got some different modules like the cardiovascular module, a lot about reproduction, infection, more about cancer and the brain. And what Rima was saying earlier about how each day of the week has a different topic. It's basically the same as year one in that aspect. For both years, again, we've got the community-based placement where you've got the GP placement alongside your studies, um, along as well as regional anatomy um and PAS. So PAS is it's kind of like a personal development module. So developing your presentation skills and research as well. So yeah.
Mhm.
Just
Yeah.
thinking about how you're going to always link this back to like your why Birmingham, your interview sort of questions. So if we start off, you can see what they're doing here that's quite unique. Kind of from the first year, they've got this idea people, patients, and populations. So almost this focus on medical sociology, kind of social determinants of health. Now, that's not something that kind of every medical school does. There's this focus on kind of what are some of the social aspects to medicine, what are some of the public health causes of sort of illness, what are some of the social determinants. And that is a really, really important focus. And so this is something that you can definitely bring into your answer for why Birmingham. So you could talk about, for example, you really enjoy the idea of public health and you know how important it is or what a big impact it can have in terms of kind of saving patients' lives and in terms of preventing illness. And that's why this course really appeals to you because there's that focus on public health. You can also talk about this relatively early patient contact, at least to some extent. You're getting 8 days of GP placement from the very first year. And so, kind of to some extent, you are going to get GP contact, patient contact in the first year to learn things like clinical skills. And if that's something that's appealing to you, then definitely bring that in. We've also got this idea of prosection. So it's the fact that you're going to be given a pre-dissected specimen and be shown it by an expert. So rather than kind of you just going in there with a scalpel, a little bit blind, trying to have a go yourself, you're going to be demonstrated a pre-dissected specimen that's already been cut in such a way by an expert for you to know exactly what you have to see there. And you have kind of expert anatomy demonstrators who are going to make sure you understand exactly what you're supposed to see. So again, that's something you could say really appeals to you because you think that that kind of extra input and that kind of demonstration would help you to visualize things. Make sure you always link it back to yourself. Why this course is what you would want.
Yep, 100%, especially about the early patient contact as well as if you're interested in public health, because that is something that carries on into year two as well. And yeah, exactly what I just said. There's not that many medical schools that do have an integration of both academic as well as sociology as well into your studies. So that's really, really good to make you a more well-rounded doctor in the by the end of the process.
Mhm.
The second phase would be year three, which is quite different to year one and two in the sense that it's the start of your clinical years. And majority of your teaching is within teaching hospital trusts, and these range across West Midlands. So you could have major teaching hospitals such as Queen Elizabeth Hospital, which we will talk about later on as well, or it can be more general hospitals such as Walsall Manor or Hereford County Hospital. And so they're quite varied, and so that is really good. And again, if you were to talk about this in why medicine, it allows you to see people right across the county. And you, especially West Midlands being such a diverse area, you will see people that perhaps English isn't their first language, or they may have several comorbidities. They could be quite old, they could be very young. And so you get a wide spectrum of cases that you can see, particularly in the larger hospitals. You often see cases that you probably would never see elsewhere. So, yeah, those are all points that could be brought up in your answers. And exactly what we've mentioned before, there is also an opportunity to increase your clinical skills, which does start very early on in year one. So for us, me and Alicia, we would have already started doing basic abdominal examinations, checking pulses, checking blood pressures, etc. From I think it was the first few weeks of
Yeah,
year one.
I think so. It was our first GP placement day. I think we managed to do a couple of clinical skills, which is quite
Mhm.
cool. So, yeah.
Yep. And yeah, so along the process, you get more and more proficient, not only in academics, but also the clinical side as well. And I personally think that's something that makes the Birmingham course very well-rounded. And In terms of intercalation, it is like you can do intercalation after second year onwards, so after third year, after fourth year as well. And we will also be going into that in a bit more detail. Okay, Alicia, do you want to talk a bit more about years 4 and 5?
Yeah, sure. So as Rima just said, about intercalation, you can choose to intercalate between year 2 and 3 or year 3 and 4. So that if that's something you're interested in, you've got that flexibility, which is nice. There's also, I think, 8 week, what's kind of 8 week blocks of different specialties in hospitals around Birmingham and the general West Midlands area. So if you're and you'll also get placed at big hospitals as well, like Queen Elizabeth. So you get to see some more niche specialties as well, which is quite nice. For example, neurology and anesthetics, orthopedic surgery. Um, so that will continue on for most of the year. Then towards the end of your clinical years in year 5, you'll get that 4 week elective. You can do that in the UK or abroad. You just have to find the opportunity yourself and apply for it. But you've got that freedom to choose wherever you want to go. To maybe if you want to experience medicine in a different country, or if you just want to stay at home, that's also possible. That's also a possibility. So yeah. Do you want to add
Mhm.
anything else?
Uh,
Definitely, when you mention something like Queen Elizabeth Hospital, really good to mention, and worth discussing something like Queen Elizabeth being a major tertiary center. So actually say that this is a major tertiary center, lots of research going on, lots of innovation. So stuff like, for example, kind of the first pancreatic trial cancer in Europe is right now being run at kind of Birmingham University and the attached Queen Elizabeth Hospital. So you've got these major attachments like this, you've got kind of established tertiary center, and that means that you see all of these diverse cases that Alicia was talking about. So do bring in that kind of idea.
mhm. Okie dokie. So, in now that we've kind of understood how this course is set to plan and set to roll out, in terms of the various teaching methods that are used, as you can see, I've mentioned seven, sorry, here, but there are a multitude of different ways that teaching is delivered. Um, for example, you have essentially your content that is delivered through various means such as lectures as well as small group teachings. And I think that is really, really good about Birmingham because although it's predominantly lecture based when it comes to the delivery of content, there is also opportunity for small group teaching post after each lecture. So you get to consolidate what you have learned, particularly in applying it to clinical scenarios. For example, if we had a lecture on the adrenal gland, we would have a small group teaching followed up from that lecture about people with different diseases that may affect the adrenal gland. And it would be presented almost as a case scenario. So it'd be like an X and YZ old person has come in with these symptoms. What would you do? What would you do? And that really, really helps you on. From what we've heard from all the years, it does help you on for clinical years as well, because you're already making the links between theory and practical and without necessarily seeing the patient in person. And so it shows you kind of the bigger picture of why you're learning what you're learning. How about like anatomy teaching, Alicia? Like, do you find that the way it's taught is like good at this university?
I think it's pretty good, I think. So, your anatomy is taught in the same groups as your small group teaching. So that's about, I think, 15 to 18-ish people in your group. So it's more like a classroom environment, which I know a lot of people at Birmingham do like. The fact that you get more one-on-one time with the tutor, which is good. Um, They've got a lot of resources as well to teach anatomy. So we do protection, obviously, you get to see actual bodies and the anatomy's already there dissected for you. And they've also got 3D anatomage tables. So those are good to kind of just get a more general understanding of the body. And since we don't do dissection, that's a nice way of us to be able to see like all the layers of different tissues in the body and things like that. The other thing that they do is anatomy practicals. So that's again in the same groups as your small group teachings. And those are kind of more just theory based, going over questions with a tutor, which is quite useful to have since it also gives you kind of a set of notes to look back on later on. So yeah, I think it does give you quite a good overall view of anatomy, I think.
Mhm. And we also have like sorting out difficulty sessions. So at the end of each module or towards the halfway point of each component, we have either Zoom sessions or in person where you have an interactive platform called Padlet, which is anonymous, so people can ask questions on there and people can learn from each other as well. And those questions are addressed within the session, and they do run quite frequently throughout the year. So it's really, really good for revision purposes. And sometimes somebody else asks something that you were also considering as well. And so all of these methods definitely help when it comes to exam season. For example, we also have interactive workshops. So these are not necessarily content that's taught at you. It can be just the content that has been taught already previously in the term. They put questions on, I believe the platform is called, oh, I can't, oh,
Then
Vivox. Is
yeah,
it Vivox?
sure.
Yeah.
Yeah.
Yeah, so there's a platform called Vivox, which essentially they put it on the screen and you can scan with your QR codes on your devices, and everyone answers the question. It's kind of like a polling system, and everyone really enjoys this. I think it's a lot better than lectures when everyone's quite quiet. Whenever we have interactive workshops, all of a sudden all 200, 300 people are talking, and it's a lot better, and we can talk with each other and figure out what the answer is. And even if we get it wrong, then we know where to focus our revision. So I believe that definitely there are so many opportunities to kind of like consolidate what you've learned in lectures outside as well. For example, I also think like seeing things in person during like prosection and 3D anatomy can kind of help link things together, because anatomy is quite difficult to learn from just reading textbooks. You have to kind of visualize it. So if you're a visual learner, it's going to be quite useful to be able to have different modes of learning. Yeah.
Yeah.
Does that kind of make sense? And I think somebody mentioned on the chat if the groups are chosen or assigned. So essentially, every year you get an M group. The M stands for medicine, I believe. So yeah, it's a group of like 15, 16 something people, and you stay with that group throughout the year. So next year we'll have a different M group, and that's how it goes. And that's your best way of meeting more and more people, because it's quite a large cohort of around 400 people, I believe.
Yeah.
So it's hard to meet everyone. And every day I still meet new people, new faces, very, very frequently. Like every lecture, I sit next to somebody new.
Yeah.
Somehow I managed to do that, even though it's been well over a term. But yeah, these ways are really, really good to like make good connections with people, and it helps when it comes to revision later down the line because you can do group work with each other. And even with the anatomage table that we were talking about, you can work in groups and do quizzes. Yeah, essentially there's just loads of different ways you can be taught aside from just lectures, which makes it quite an integrated system. And again, these are all points that you can be mentioning if you were to ask what made Birmingham stand out to you. So, in terms of why Birmingham, specifically for the question, do you want to take this, Alicia?
Yeah, sure. So firstly, there's early clinical exposure, as we were saying earlier, from the first term. I think it was maybe within the first month, even we were able to go into GPs, practice some clinical skills on each other, and meet some patients, which is quite nice. Um, there's also integrated teaching and a range of teaching methods. This is something that I really like personally because if you find that one teaching method doesn't work for you, you've at least got a bunch of other ways that content is being delivered to you that might work better. So you've got options basically, and people can also teach each other. So if they understand something better than you, those small group teachings are kind of a good way to make friends and form study groups, which is quite nice. Thirdly, pro-section via regional anatomy. It allows you to appreciate how the systems interact each other by kind of first understanding each region first, and then kind of seeing how they all link together and how the body works as a whole. Um, they've got many opportunities for intercalation. So at the does it say on there? Oh no, it doesn't. Sorry. So it's got a lot of research going on in Birmingham. I think like Otis was saying, there's a trial for pancreatic cancer, I think. So there's a lot of things to get involved in if you want to. And I think even some older years, like fifth years, are running their own like little studies and things to write papers. And you can get involved in those as well, if you search out the opportunities, which is cool. Um, there's a lot of a large amount of societies. I think there's over 300. So there will be one for you to get involved in. Um, it's also a big city. I think it's the second biggest city in the UK. So there's always activities to get into. You can go to town really easily via the train, and I think it's a good city for student life in general. Um, Okay, and then there's also a wide range of hospitals. So, for example, Queen Elizabeth, like we were saying earlier, it's a really big tertiary hospital. They've got a lot of more specialist doctors in there to learn from if you do get placed there in your clinical years, which you might not get at some other smaller unis. Um, but even if you're not placed at Queen Elizabeth, there's a lot of other hospitals that you can get placed at around the West Midlands, like Birmingham Children's Hospital, Royal Orthopaedic Hospital, um, and I think there's one more thing on the slide. Oh yeah, now it's there. So yeah, as I was saying earlier, there's a lot of research going on in general in Birmingham. So if that's something that you're interested in, maybe academic medicine, then that might be a good thing for you. Yeah.
Mhm. Yep.
Anything else you want to add?
Uh, no, I think you've covered everything.
Okay, cool.
Mhm.
Me, definitely think about how we're going to actually structure this. So we've got lots of brilliant points here, and I guess the idea is just having a think about what order we're going to put them and how we're going to present them to the interviewer. So I would definitely start for any question like this, Birmingham or a different one. The first thing you're going to mention is I want to study here because of the course. And you'll say, kind of, firstly, I think what really appeals to me is the idea that we get early clinical exposure. So, kind of, when I was applying to medicine, the number one thing for me was always kind of being able to meet patients, interact with people from all kinds of backgrounds, practice my clinical skills. And I think that that is something that is so, so important, kind of how you communicate and interact with patients. And that's something that I've really seen during my work experience. And so, because of that, I think that Birmingham would really appeal to me because of the early clinical exposure with GP placements in the first and second year. I also like the focus on public health and preventative medicine, including the opportunity to learn sociology in the preclinical years, which is something that a lot of medical schools don't usually do. What I also like about the course is the fact that we have a chance to learn through prosection, which means we're going to get shown by an expert demonstrator exactly what's going on, and that's going to help us to visualize and understand anatomy. And while kind of a lot of medical schools these days are going towards problem-based learning and it's very much self-directed, what I like is that Birmingham has kept a relatively traditional course structure that is quite lecture-based. And it does mean that we make sure we always do grasp the content in a really good sense of detail so that we can then apply it in the later clinical years. But that said, there are still kind of a range of teaching methods, and there are opportunities to focus on your more sort of group-based work to solidify your learning after the lectures have taken place. So there is a variety. And so that's going to be your first point, talking about why you like the course. Then you're going to move on to your next point. And your next point is you're going to say, I really like the idea of research. And I know that Birmingham is a huge center for medical research, including the attached tertiary Queen Elizabeth Hospital. And where you're going to find ideas for research, well, I've just sent a link in the chat and I'll send it again. So if you go on this page, you'll be able to find an example of some research. So pick one article that really appeals to you. And kind of the one that I was recommending is talking about the cancer vaccine trial for pancreatic cancer, which is the first in Europe happening here. But there are loads of others. It's definitely cancer is a big area. There's one for ovarian cancer happening as well. And I would then link that back to you as a medical student. So you can say that there's all of this research happening at Birmingham. And I, as a medical student, know that there are lots of opportunities for me to get involved with this. For example, by joining societies and give some examples. So stuff like, is there an oncology society? Is there a medtech society? By joining stuff like this, I can get involved. There are also opportunities just to reach out to these researchers who are going to be taking my lectures and they're experts at the forefront of their field. And if I just reach out to lecturers like this, I'll be able to get access to opportunities. And a lot of Birmingham medical students have told me that the lecturers are really keen for students to get involved. And the third point is that I'm really keen on, for example, cancer research. And I've seen that there are all these clinical trials happening at Birmingham. And I know that there's an intercalation option here that I can intercalate in MRES clinical trials. And that's something that really appeals to me. So again, kind of if you talk about intercalation or if you talk about research, linking it back to yourself as a medical student and how you're going to be able to do that. So point number one, course. Point number two, going to be all about your research. And then point number three, you can talk about the city and the location. So you mentioned kind of any reason why Birmingham is going to appeal to you. So are you keen to live in a city environment, a diverse environment? Is that going to be maybe something that you enjoy? Is it close to home? But also have a think about kind of living in a major city, what that's going to mean for your medical education. So it's a really diverse population. And what does that mean in terms of the kind of conditions you'll see? So, kind of like some ethnic groups have a higher prevalence of certain conditions. And so, kind of with like a high South Asian population, you might see a lot of cases like type 2 diabetes, which maybe aren't as prevalent in other populations. But also, kind of, you're interacting with people from a huge variety of backgrounds. And when you're doing that, you're kind of practicing communication skills, people from all walks of life. Really, really important. So, why does the city appeal to you? Really diverse population, really major established hospitals, and then you talk about kind of established tertiary centers with these clinical trials happening. And finally, you can say something kind of that's a little bit more fun, and you can say, I've gone on the Birmingham website, and I know that there are a lot of more enjoyable societies that I can do to help me relax. And then you'll discuss stuff like, say, cultural societies, religious societies, so like Islamic society, Hindu society, different ethnic groups, and also any sports, any music, anything like that you're involved in. And I would mention that towards the end. And then give your conclusion. In conclusion, one, because I love the course, two, because of the research, three, because the city and the location really appealed to me, and four, because of these societies I'd love to join. And that's how your answer should look.
Mhm.
Are there any societies that you guys are enjoying that you would recommend for either of those two, like career ones or enjoyment ones?
I think one that I really like is the Islamic Society. So, particularly with Ramadan coming up, they do like community iftars and stuff, which is nice. And I'm looking forward to that hopefully in a couple of months. Generally, it's a nice community, which is another thing that I like about it. In terms of academic ones, there's an anatomy society, and a surgery society that I've been involved in. Actually, the Surgery Society was the one where I think there was a fifth year who was running a small study into how to teach suturing, and it allowed us to basically learn how to suture for free. And I was just there able to learn, and that was helpful for them for their research, and that was really fun. They've also got a lot of sports societies. So they've got ones with the uni itself and also with the medicine society specifically. So I'm part of Medsoc netball, and I do that once or twice a week, and it's just a nice way to de-stress really. So yeah, there's a lot to get involved in, and there will be one for you. But yeah.
Yeah, definitely. I believe Birmingham MedSoc is the largest in the country.
Yeah.
And within its MedSoc, there are like hundreds of societies. I personally joined, there's a society called Teddy Bears Hospital, and it's an awesome society. It's essentially you go into like primary schools and you teach little kids about health, and you have like a massive doctor suitcase with crazy exaggerated sizes of everything. So there'll be a massive stethoscope or like a massive toothbrush to teeth, like to brush teeth, like massive teeth. And it's great because you're developing your communication skills, but it doesn't feel like you're doing it for that. Like it feels a lot more rewarding and you forget about the stress of exams. And I think definitely for a question about why Birmingham, exactly what Oja said. I believe the course structure, I mean, yeah, the course structure and research is really, really important to mention because that's something that they definitely pride themselves in. But also to like think about outside of academics, like how are you going to maintain that work-life balance? Because they also do want to know that you have measures in place and that you're not coming in with like the wrong impression that because everyone's going to face a point where it's going to become difficult. So having things like netball or even if you're not sporty, like we will show you some options for societies that are crazy. And even if you haven't found something that you enjoy, you can start your own as well. And I think that's another really, really good like avenue to de-stress as well. So in
I've just
terms,
spammed so many into the chat. So, guys, start to take a look. What have we got? Examples: Friends of Birmingham Children's Hospital. You can volunteer to help young patients at the local children's hospital. You've got
Mhm,
global brigades, internationally empowering communities in poverty, supporting them. We've got Med Minds working on awareness of mental health and well-being. You've got Friends of Médecins Sans Frontières. So, kind of like MSF, they work on global humanitarian issues and like kind of other under-resourced countries, how can you support them? We've got the teddy bear hospital that Rima mentioned, so helping children at local hospitals to engage better with healthcare services. We've got street doctors where you're educating young people about, say, avoiding knife crime. And then we've got all of these different academic societies. So we've got stuff like anatomy, anesthetics, ENT, gastrointestinal, oncology, psychology, so many different societies, psychiatry. And so make sure you know about some of these, both the academic ones, but also some of the more fun ones, and make sure you can bring them in. So I would
mhm,
recommend like maybe pick one cultural one, one academic one, and one sport one, or one sort of recreational one, and then mention those in your answer at the end.
mhm. And just a bit more detail about the research. I know some of you are asking as well. There is the first pancreatic cancer mRNA vaccine in Europe, so that is something I'm pretty sure Birmingham would be proud about. And since it's quite recent, it would be quite impressive if you could mention it. If you did mention it, there's an accurate ultrasound test that could detect 96% of women with ovarian cancer. So again, these are like big medical breakthroughs that are happening quite recently as well. So all of these are very relevant to mention. In terms of Birmingham specifically being a Russell Group university, it loves the research it does, and it's got several different trials. For example, at the bottom, I've included Birmingham Clinical Trials Unit. There's Centre for Liver and Gastrointestinal Research. There's a lot of different opportunities, not only for yourself to get into, but even later down the line if you want to publish things or if there's something that you want to get in touch if you're really interested with, um, like, I don't know, rheumatoid arthritis, and you realize that there is a centre that specializes in research on rheumatoid arthritis. It can help kind of direct you to the right like areas as well. In terms of intercalation, that is another thing that I'm sure a few, actually, hopefully most of you would be considering. Because again, it's always really, really good to try and develop your research skills throughout your medical course career, because even as a doctor, that's something that you're constantly doing is keeping up to date with your knowledge. And you could link this into lifelong learning. And because you enjoy that, maybe there's something, a course that Birmingham offers that sparked your interest. For example, there are several people that are quite keen on pursuing surgery or surgical related specialities. They do like choose to go on do the Masters in Clinical Anatomy because that, again, it kind of links to what they want to do, but it doesn't necessarily need to link into your specialty. If there's a specific topic that sounds interesting to you, you can go and do it. For example, um, there is one on technology, I believe. I don't think I've mentioned it here. There's one on technology. So if you're interested in med tech and like leadership, there's masters and BScs you can do in that. Um, Anything else you want to add?
I think going back to the Masters in Clinical Anatomy, so for that one, Birmingham, if you're doing the normal course, it's prosection, but with the clinical anatomy, you have the opportunity to do dissection for a year. So if dissection is something that you really, really want, but you think you actually really like Birmingham, so you would rather go there rather than go to a different dissection uni, there is still an opportunity to do dissection. So that's something that I know a lot of the surgical students, I mean, a lot of the students in like fourth and fifth year who want to do surgery, that's something that a lot of them have done. So again, linking back to the societies, those are a really good way to meet people who can give you advice as well, maybe on things that you can do to advance your career, which is something that I like. So, yeah.
Mhm. And in terms of societies, there are tons and tons of societies, and these are actually external to the MedSoc. MedSoc has its own like host of societies, and essentially I went down the list and tried to find the most creative or the weirdest ones I could find. So we have the Bad Film Society. So who says you need to go to a film society when you can go to a bad film society? Essentially, I did actually read what they do, and they meet up weekly to discuss essentially make fun of movies. So they watch movies that they know that have like potential to be made fun of, and they do that as a hobby. So if that is something you're interested in, like that is something that's not medical, but it will take your mind off the medicine side of things. For example, there's UOB esports if you're a gaming fan. I'm not too knowledgeable on that area, but for some of you, this might be something that you're interested in. There's a Doctor Who society. There's even a tea society if you like tea. I don't know what they would be doing other than drinking tea.
I think they go on like cafe crawls, and basically there's this street near the uni called Bristol Road, and there's a bunch
Mhm.
of cafes on there. So like once a week or once a fortnight or something, they actually go and visit the cafes and drink tea. So if that's
No
something
way.
you're into, there's that.
hmm And just because Birmingham is almost in the centre of England, you can still do Brom surf. I don't know, unless they're surfing on the canals, they're probably taking you to the coast. So there's like literally anything and everything you can do within the societies. There's a hide and seek society where people hide around campus and then go and find each other. So I actually only heard about this recently. There's again skiing, just because we don't have skiing Alps in Birmingham, we can still ski somehow. There's cocktail society. Cheese Society, if you like cheese. Um, and I couldn't fit all of them onto one slide, but genuinely, there are so many. And they only get weirder than this. So there's definitely something for everyone out there. Even if you're not a fan of tea, maybe you just, I don't know, go along because your friend's going along and you could actually make really good friends in the process as well. So essentially, I know you guys have all picked medicine because, I mean, sorry, Birmingham for its course and research, but there is also opportunity for you to de-stress as well, essentially. And it's good that you're aware that if there's these like range of opportunity, there's definitely something going to be there for you once you come as well. So, in terms of a sample timetable, I'm sure that I know when I was in your position, I was quite confused as to like how the day actually works because it's not like your standard school routine that you may have been used to. For example, we have lectures, normal lectures where they teach you content. We also have regional anatomy sessions, which is where it's the taught anatomy, so that's with your slides and they're telling you everything. But the most of the learning for anatomy doesn't happen there. It happens then when you go on to those different like paths, for example, prosection or anatomy practicals. This is kind of regional anatomy sessions kind of just give you a taster of what's to come, and then you consolidate within the other methods that you have. Do you want to carry on, Alicia?
Yeah, sure. So, um, okay, so PPP, that's the sociology module. Like we said earlier, I think, you can see how each day kind of has a different focus. So
Hmm.
there's MTM, the molecules medicine or biochemistry type thing on Monday. Tuesday, we've got the cells, endocrinology and pharmacology, PPP, the sociology module. Um, Friday, you'll see NAS, that's the neurons and synapses module. So there's it switches up. It's not like you're doing one topic for ages. Um, so it can feel like a lot to manage sometimes, but I personally like it because you kind of get a break from each thing, if that makes sense. So yeah.
And I
Um,
also think that having different modules, I mean, components each day, they often end up linking somehow. So there'll be a disease we learn about in molecules to man, and it will come up later on in like neurons. And you kind of get more of like a holistic view on each topic from different angles, from a pharmacological perspective, from an endocrine perspective, and like from a neurons perspective. There's always a different angle that you can look at different diseases from. And like as you progress through the term, your knowledge of different things increases as well. So, for example, if a certain symptom means that maybe your pupils dilate, then why are they dilating? Is there an endocrine reason? Is there a molecular reason for that? And then it just makes you understand things a lot better, I think. And also something that wasn't mentioned before is there is also opportunity for self-directed learning. So these learning sessions aren't necessarily with lecturers. So it's like allocated time, you get a set task and you complete it. And yeah, you can do it at home. You can do it in like there's usually a lecture hall that's been reserved, but you can do that in your own time. There's your pro section, and again, every Thursday it's usually like alternating. So the entire cohort is split into two groups. So if group A goes this week, then group B goes next week. So every Thursday there will be placement, and you will be placed across West Midlands. Um, Yeah, and it's from 9 to 5. So that is like a standard GP timing, I guess. And you're in usually groups of around 6 students.
yeah.
And you can arrange to go together. So I know for my placement group, we all take the Uber together just because it's easier and because our GP is like 50 minutes away. So if we were to take public transport, so it just helps kind of sharing the cost. So it kind of works out that way. But again, this placement is really good because sometimes you'll see something and then you'll be like, oh, I remember learning about this. And essentially, you just get a much more of a complete curriculum.
Yeah.
And we also have your anatomy practicals.
Yeah.
So that's enough of us talking about why you chose Birmingham. And now on to why Birmingham would want to choose you. So, medicine interviews. In terms of the format, which Alicia can go through.
Yeah. So there's 6 to 7 stations. I think in mine there was six. I think it is normally six.
Mhm.
Yeah, so each one is 8 minutes. And you get the first 2 minutes is just preparation time. In that 2 minutes, you have the station, um, you get like a card outside the station and it's got the questions on there. So you can think about the question while you're sat outside for 2 minutes. And then you go in, you do your little interview, and I think at the end the cycle just repeats. But the 6 bullet points here, those are the station titles. So there's critical thinking. That's kind of more like SJT ethics kind of questions, or just they'll ask you to evaluate something. There's commitment and insight to medicine. So asking more about like your work experience, what you've done to kind of get a better idea about what medicine's like. Um, there's dealing with personal and ethical challenges. So that one will also be a bit of SJT ethics type questions. Um, data interpretation. I think this is something that it's not as common for a medicine interview, but basically you'll be given like a graph, and what you have to do is kind of interpret the graph, try and identify the trends in it, and maybe explain why the trend is there. The fifth is role play. So this is a common one at most medicine interviews. And then calculation station. So I think this one's actually kind of uncommon. I haven't seen many of these at different medicine interviews, but it's basically you get a couple of questions to do and you enter your answers onto a computer. Um, and the level is not much more than like GCSE maths, to be honest. It's more just getting used to the style of questions. But yeah, it's about an hour in total, I think.
Yeah, I think it's like an hour as well. Um, in terms of anything specific, I think that I didn't know before doing the interview, essentially exactly what Alicia mentioned. You have 2 minutes to read the station outside. There'll be kind of like a laminated card, and they'll ring a bell. There is a physical bell that they do ring. Um, and so that is your cue to go into the station. And then you have your 6 minutes, and it's usually two questions per station. And so that kind of works out to around 3 minutes per question. So then at the end of that 6 minutes, you hear the bell ring again. So it's time to move out and then go. And maybe some of you guys have already done a few interviews, but they do go quite quickly. Um, and it's no different for Birmingham as well. Like you're in and then you're out before you know it. So it's every single station is a new, like fresh, clean canvas as well. So even if one station didn't go as well as you'd have hoped, that you'd have wanted it to, the next station, they don't know what you've just said. So it's a completely different new station, a completely different new interviewer, and it's like a new chance as well. So try to like when you leave the station, just forget about what's happened and move on to the next station because there's 6 stations, so there's six chances for you to impress them, essentially. In terms of general interview tips for Birmingham, we would say definitely practice as many questions as you can and a range of questions. They do give you the station titles on the website, and that can help you narrow down the type of questions that you need to be practicing. For example, if you need more work on data interpretation, then perhaps it can be the randomest like graph. I think on BBC News they always have random graphs. It could be not medical related, it could be about the economy, it could be about anything, but try and get into the routine of looking at the overall picture and then zooming in onto the details because if you can do that then any graph they throw at you should be fine. And there's no like you don't need to have done A-level maths to be able to do data interpretation or like higher level maths. It's very much explain what you're seeing and suggest why you're seeing what you're seeing. Um, yeah, another thing is try and do mocks if you can, because that's your best shot at trying to put yourself under the pressure of answering questions. And we will have an opportunity to for you guys to answer. So maybe step outside of your comfort zone and like give it a shot. Because like I said, with interview, it's not like your A-level biology or chemistry. It's not something you can just memorize and then just regurgitate. A lot of it is adapting on the spot because there's no way that you guys are going to have to remember all the different question types they're going to ask you. So it's identifying, okay, what is this question asking of me and how am I going to structure my answer, covering everything I need to cover, and it's being able to adapt on the spot essentially. That's also something that indirectly testing through interviews. In terms of if you're not sure what to answer, try to talk through your thought process. I think that always helps, especially in the stressed environment. You might forget what you were going to say, or maybe you've done a similar question and you have an answer in your head, but it goes out and like at the worst moment. So try and talk through your process. I always think using the question. Sometimes if you read the question, you like remember what is the question trying to ask me, and also think you're there for a medical school interview. So whenever you can, try and sell yourself as well. So data interpretation, it's hard to sell yourself there because you can't really be talking about work experience for data interpretation. But for other stations, wherever you can, talk about how you have actively shown skills that would make you a good doctor in the long run, and keep making that connection between you, as a prospective medical student, as well as a good doctor. Something else we would say is definitely come across as friendly because I'm sure that all of you are very, very friendly people, but the interviewers need to get that message across as well. And at least for my interview, they were all quite friendly. It's not like other interviews at different universities where they're known for being quite cruel. I think at Birmingham they generally were quite nice. As in they were smiling, they weren't blanking you. I think I had one station where there was a guy who wasn't giving me much expressions on their face, but I'm pretty sure they were a doctor, so that could potentially explain why there was a lack of expression. But there's also a station with medical students, and they're very, very supportive because they also understand that you're stressed out. So don't kind of come across, although you're going to be nervous, I think if you smile, they will smile back at you, and they'd be less likely to think that you're just antisocial or you've just come and you're just going to throw information at their face. It's more of a conversation. So do try and smile at your interviewer. It's up to you if you want to shake your hand. That's a personal preference. I personally didn't because I feel like if they'd blanked me, that would probably knock my performance. So I personally didn't opt to shake hands. Although saying good morning or good afternoon, that could be something because then they don't necessarily have to reciprocate that if they don't want to, if they want to maintain this like hard exterior. In terms of the calculation station, which some of you might be worrying about because not a lot of universities do it, I would say definitely try not to overcomplicate it. Exactly what Alicia said. There's nothing that a year 11 can't do, or there's nothing that year 10 can't do. So you guys are definitely capable enough of answering those questions. The only difference is instead of maybe in maths, you get crazy scenarios about someone building a fence or someone like selling apples and crazy things. But for the calculation station, it will be mainly medical related. That's the only difference. The numbers stay the same. So it's still going to be your basic timesing, dividing, adding, subtracting. It may, for example, be in the context of giving someone medications or diluting a drug. And diluting a drug sounds complicated, but you all know how to divide. So it's it's essentially it's not difficult. So try and look beyond the words and the crazy drug names and look at the numbers, and they will hopefully work out to make sense. You do get a calculator and you also get notes if you prefer working it out. But I think for me personally, when I was doing the calculation station, even though I was doing A-level maths at the time, I was second guessing and questioning everything. So even 2 times 2, I was probably typing into the calculator just to be sure, because there are only three or four maths questions. So just to ensure that I don't make silly mistakes, because I am the queen of silly mistakes when it comes to maths. So I did check everything on my calculator and worked out everything as well. So it's up to you. I would say also don't, on the other side, don't be overconfident with your answers because sometimes they have a twist at the end, like they want your answer in milligrams instead of grams for a drug dosage. So don't be on either end. So don't be too like doubting yourself, is this right? Is that right? But also don't be overconfident as well. And that should be okay. Again, what I mentioned about data interpretation, about zooming in and suggesting any trends that you can see. So the next section is going to be practice MI questions. So we have 2 questions that we're going to be asking.
Just
Um,
before we go on to that, for the
mhm,
maths section, two things that I would say really important.
mhm.
One, make sure you know this idea, weight by volume. So what does that mean? If I tell you that we have, say, a 5% solution or a 10% solution, and I don't say anything else, you might think, oh, what does that mean, 10% solution? There is this kind of measurement unit that is used quite often in medicine called weight by volume for concentration. So if I say that we have a 5% solution and I don't give you any more details like 5% what that implies is that you have 5% weight by volume in grams per 100 ml. So a 5% solution will be 5 grams per 100 ml. And that's just what you have to interpret it as. If they tell you 10% solution, that'll be 10 grams per 100 ml. So know what this idea of weight by volume is. You might want to write that down. And the second thing would be, I found it very similar to sort of UCAT QR in terms of the way that it looked, in terms of the computer system, but probably a little bit less time pressured. So what I would do for practice, know kind of that idea of weight by volume for sure. Maybe brush up on a little bit of mental math skills if you're not doing A-level maths. But main thing would be maybe go on the UCAT website, practice answering a couple of QR questions, but maybe not even time pressured. Just practice answering them and having that familiarity with the computer system, doing the calculations, just to avoid panicking and making silly mistakes. The actual questions are not hard. Besides, just sometimes people don't know what that weight by volume means.
Mhm. Yeah, and often the calculation stations, they do have several steps for each question. So it's not, I did say it's simple, but it's not necessarily going to be just one step that you have to do. It might be, okay, an ex-patient has this much grams of this drug today, but they have it for 2 weeks. So then you have to work out the total dosage for one day and then times it up for 2 weeks. There will be some element of two steps or three steps involved. It's I would definitely use the paper in front of you to kind of write your answer from each step so that even if you get wrong at somewhere, you can kind of figure it out as well where you went wrong. Yeah. Anything else?
I think
No?
I think you covered everything really well.
hmm Okay, so
Let's go into the
yeah,
questions.
on to some MMI questions. So we have two questions, and we would appreciate if we could get two volunteers. Um,
Let's show the question first,
okay,
and
we
then
will
maybe
show the
pick
questions.
volunteer for
So the
each.
first question is dealing with personal and ethical challenges. So you're a doctor and you observe a colleague frequently arriving late and they are taking extended breaks and occasionally making inappropriate comments. So how would you address this unprofessional behavior? This is your first ethical challenge. Your second question is
Well, let's
evaluate.
just focus on the first one
Oh,
first, and then like get an answer for this, and
got
then do.
it. Got it.
So let's give them a minute to think, and then pick someone to give this a go.
Mhm.
The first person to have their hand up was John. So whenever you're ready, John, you can make a start.
All right. Firstly, I'll try and talk to them privately and, like make them aware. They might not know that they're making inappropriate comments. And then after that, like I would give them some time, see if they improve, like if there's an improvement in their attitude and their punctuality. But if they don't improve, I might have to like ask other colleagues for advice on what to do and try and apply their advice. And if that still doesn't work, I might have to escalate it to a more senior member of the team just to let them know that my colleague isn't like acting as they should. But it's important when I tell them, like let them know, I use appropriate language and I don't make it seem like, I'm bossing them about. And also, I need to do it in a private place away from patients because if you do it in front of a patient, the patient's trust in doctors might fall, and this might affect their quality of healthcare they get later on because they won't trust the doctor in their judgments as a general.
Mhm. Okay, so we'll take it in turns to give you some feedback on that. So I personally thought it was really, really good how you made the point that you would be compassionate when approaching the person. A big emphasis in your answer. That's what I got from your answer. And you mentioned that by saying you'd want to take them to a private place and make sure you're not make sure you're not confrontational when you're asking them about what's happened or what's going on. I thought that was really, really good how you mentioned how you would take an empathetic approach to the problem, but also you didn't let that kind of mask the fact that it is a serious problem and that you would want to take serious action. Um, is there anything, Alicia, that you thought could have been improved?
Yeah, so I think it was good in general. So I like the same things that Rima said. Something that maybe you could add, I think you were kind of getting at this towards the end, where you were talking about the trust, that patients have in doctors. You can kind of link that to how doctors have a role, to uphold the image of the NHS in general, and maintain the trust in in the profession. That's something that the GMC really value. Um, I think when you talk to your colleague privately, as you said, which is good, you can try and understand if there's other reasons why they're acting this way. Assume the best in them. Don't just assume that um they're just skiving, for example. There might be something going on in their life that's making it difficult for them to come into work on time, and making them have to take extended breaks. So another thing you can do is maybe offer support and empathy with your colleague. Offer them maybe to, if they want to, they can always come talk to you, kind of as a friend, not just as a colleague. Um, and yeah, I don't know if you had anything else to add, but I think you covered some really good basic points.
So I think definitely I would second what we've just heard in terms of the answer definitely containing kind of the important elements here, which are kind of the key ideas being that you would take action, that you would do it in an empathetic way, so on. The key thing, I think, for any sort of situational judgment question like this is that everyone knows what the right answer here is. So, kind of, that you're going to say we have to take an action, and that's pretty much a given. No one is going to say we will ignore this problem. What is going to maybe make your answer excel is by having a good structure. So, the way that you want to approach any of these sort of personal and ethical challenges questions is by starting off by addressing why is this a problem? So I would begin by talking about the idea of professionalism. And so you can see what is happening in the scenario. You would start by saying that this is a difficult situation and is definitely causing you maybe some concern. And why? Because you're seeing some very major problems here in terms of a colleague arriving late and occasionally making inappropriate comments. So you can think about what are the potential concerns associated with that. For example, if the colleague is arriving late, is that impacting patient care? Is that meaning that maybe patients aren't being seen as quickly? Is that putting more burden on other members of the team who are now more likely to make mistakes? If he's taking extended breaks, again, is that causing the team to run to delay? Is that causing patients to wait for longer? He's occasionally making inappropriate comments. How is that going to affect doctor-patient relationships? How is that going to affect public trust in the healthcare profession? And you're going to say that all of the things here are clearly a major problem because they can cause these problems for patient safety and for patient comfort and well-being. And at that point, it would be a really good idea to link this to, for example, GMC Good Medical Practice and talk about kind of how GMC Good Medical Practice outlines how doctors should behave in a professional manner and how making inappropriate comments would be completely opposite to this. So I would start by giving that background for any kind of SJT question like this. Why is it an issue? What would I change? What do I need to be aware of? That's the first thing. Then I would go into how I need to solve it. So the first thing is exactly as you said, take the doctor to one side and discuss the issue with them. So I would seek to find out if they understand what is the problem with their behavior and why I have to be talking to them about this. So do they understand? And if they don't, I would explain it to them. And I would try to find out specifically why are they behaving in this way. So is there anything that is particularly causing this to happen? Are they under a lot of stress? Are they maybe not sure what the behavioral expectations are? And based on that, you're going to offer support to your colleague. So if it is that they're facing certain problems in their day-to-day life, then you're going to offer to be there for them and you're going to offer to help them. If it's that they don't understand the behavioral expectations, then you're going to have that conversation with them privately. And if, as kind of, we're not able to get past this, if the colleague is not improving, at that point, you would escalate to a senior. But in terms of your structure, the key thing is kind of start by having that background. What is the problem? Then talking about what would you do? And at that point, going through kind of all of the empathy side of things. And finally, when that doesn't work, then discussing the idea of maybe escalating to a senior, if that makes sense.
Yeah, I would agree with that as well. I think for ethics questions like this, it would be a good way to approach this by breaking it up. For example, there are three problems that have been raised. This fact that they've been arriving late, they've been taking extended breaks and making inappropriate comments. And in this situation, always like remember that the patient is the priority. So always think how a problem could affect the patient. So even if this scenario was different and it was about a doctor coming in drunk, for example, think about not just the impact on like professionalism, but how are the patient's safety going to be impacted? And I thought a point that I just mentioned was really, really good about, particularly about taking extended breaks. Does that mean the rest of the staff are then having to make up for that as well? And that's having that kind of wider view on each question would definitely make your answer stand out because exactly what I just mentioned. For questions like this, although there's not a set answer for anything, everyone will, if you have prepared, everyone will have very, very similar answers. So it's kind of making your answer stand out by thinking about different perspectives on the problem. So from the patient's perspective, from the doctor's perspective, from the rest of the colleagues' perspective as well. And I think that would definitely help elevate the answer. Did you have any
GMC good
questions?
medical practice, I would add kind of some specific points that could be mentioned. So
Mm-hmm.
take notes on these and like feel free to use any of them. You don't have to mention all of them. So you could mention, for example, the second domain in GMC good medical practice is all about patients, partnership, and communication. And that includes communicating effectively with patients with courtesy and treating them with respect. And kind of making inappropriate comments would be a complete breach of kind of domain two of GMC good medical practice because you're not treating patients with respect, you're not communicating with them effectively. We've also got kind of the idea of like colleagues, culture, and safety, and kind of promoting a culture of a positive working environment, treating colleagues with kindness and respect. Again, if you're kind of arriving late, you're putting tasks on colleagues, you're making inappropriate comments, then that's not something that you're doing. And even you could link it to domain four, so the idea of trust and professionalism. And again, are you kind of behaving with professionalism if you're arriving late, if you're taking extended breaks? Is that kind of in line with what the general public expects of you as a responsible medical doctor? So definitely link it back to GMC Good Medical Practice, any one of those options.
Mm-hmm.
And would it be a good idea to read it? Yes, it would. If you've not done already, then do read it. I will paste the link in the chat.
Okay, and for our second question, um, we need a second volunteer. And the question is, evaluate the impact of social media on health.
So I think, Jeevan, you had your hand up earliest for this one. So whenever you're ready, feel free to take up to a minute to think about it. And so just checking, Jeevan, you are happy to go for it, right?
Yep, I'm happy to go for this one.
Yeah, so whenever you're ready, just let us know.
So I would say when looking at the positive and negative impacts of social media on health, I would say there's definitely been two different sides of this. For me, looking at it more as a dental student, I can see that the key positive impacts that social media has had is with spreading, for example, public health and knowledge among many people, particularly as young people now use social media instead of regular news outlets, for example, the news, BBC, having a platform where you can easily spread information, for example, information about fluoride toothpaste, information about water flossers, flossing, just simple information that can be easily accessed by people is really positive. Additionally, social media has opened so many doors for dentists themselves and professionals. For example, with marketing and spreading information about new practices, resources, it's made it much more accessible for up and coming dentists to spread their own news, information, and research. However, there is definitely a caveat to social media in the sense that because it is so accessible for people to just post whatever they want, it can be definitely misconstrued and misinformation is very easy to spread. A particular time that this was seen was, for example, when fluoride was compared to poison, and that very quickly spread very fast on social media. And many people were not using fluoride toothpaste or having mistrust with their own dental professionals, as they believe that dentists were giving them toothpaste or telling them to have toothpaste that contain poisonous chemicals. And that definitely creates a massive barrier between patients coming into their dental practices and seeing dentists as healers, for example, and seeing them instead as people that are trying to cause anxiety in them. And that definitely breaks down the patient and dentist relationship. Another issue that can come from social media as well as misinformation is the fact that many dentists can sometimes spread information about patients that can breach confidentiality, and sort of the rules of confidentiality can be the lines can be blurred quite easily. As for example, sometimes a dentist may, we've seen this quite a few times, where a dentist may say some information about a patient, but yet that patient can then be easily identified, and that makes it really, really difficult for dentists to share their own information about their patients, as it does breach the Confidentiality Act. And as identified by the GDC, dentists and dental professionals are required to uphold the profession and also maintain confidentiality of patients. And overall, you can see that as more dentists and healthcare professionals are talking more about this, it sort of creates a distrust between the patient and the dental professional, as professionalism is sort of blurred overall. As for example, if a dentist speaks about not even just health related stuff, but for example, just showing that they're going out to a club one night, that can cause a bit of a distrust with a patient and a dental professional, and sort of remove that sort of element of professionalism, as professionalism is not just simply in your 9 to 5 job, it's also you're constantly required to uphold that and show that throughout your time as a professional. And I would say overall, while social media has had fantastic implications for public health and being able to bring access to patients that maybe weren't able to see many things, it also has brought a massive implication in the sense of confidentiality. The lines between that have been blurred, and also misinformation just spread so quickly. So overall, social media has been beneficial, but there are still many drawbacks.
Mhm.
So overall, would you say it's a net positive or a net negative if you had to conclude?
I would still argue that it's a net positive, as many patients can access information that was used to be quite difficult to see. For example, going into the impacts of fluoride. However, you can still argue there is a negative implication, but I'm still for it.
Mhm. Okay, so personally, I felt like your structure was really, really strong at the very beginning in particular. I thought it was good how you acknowledged that it's a complex situation and there are both pros and cons. And the key word here was evaluate, and I think you did that justice. You definitely talked about pros and cons from a dental perspective, which I thought was good. Something that I particularly thought was really interesting is how you mentioned a real case where people like the misinformation spread about fluoride being poison. And I think it's really good that you've incorporated that in as well, because it shows wider reading in an indirect way. And you don't necessarily need to be asked about wider reading. You can bring it in if it's relevant. And I think this was a really relevant place to put it in, like bring it into, because it backed your point with the fact that misinformation can spread and the consequences it can have. If we were talking about this from like a medical perspective, you could be thinking about maybe the MMR scandal, because that raised a lot of like problems, and vaccine hesitancy is something that's still happening. So if you wanted to think about it from that perspective as well, I always think bringing in like cases or things that you've read is always just going to add more to your answer, because it's going to set you apart from the person who's just answered the question and the person who's going to answer it next. I thought the one thing that you could maybe add to your answer is, because the question focused on the impact of it on health, potentially talking about unrealistic standards, particularly for dentistry. You could be mentioning how people can have like an idea of what, I don't know, their teeth should look like, and that could lead to low self-esteem and more like mental health impacts it can have as well. I think you've focused a lot on professionalism and how it can impact patients' perception, but maybe also talking about direct impact on health as well. And I think at the conclusion, you mentioned overall a few times, so kind of wrapping it up as one like cohesive conclusion would, like from the start, it was amazing, but like at the end, if you had a more cohesive conclusion, it would kind of bring a completeness to your answer. What did you guys think?
I think honestly it was really good. Something that I liked at the beginning, Rima said that you started off really well. You signposted what your answer was going to be about. So you said that it's a complex argument. There are two sides to it. So it kind of sets you up to have a good structure all throughout your answer, which is a nice thing to do. Um, Other things, I think something that Rima said, how it particularly with questions that might ask about mental health and stuff, you can bring in the biopsychosocial model. So that's basically how your mental health or like a poor living environment, for example, that will damage your mental health and that will lead possibly to physical illness as well. So that's something that you can put in general for mental health questions. But yeah, otherwise, I think it was a really comprehensive answer. So yeah, really well done.
Yeah, definitely would second kind of both of those feedback points. Brilliant answer. Very well responded. And kind of for the majority of people here who are going to be medical applicants, everything here that has been used to answer in the context of dentistry equally could be done in the context of medicine just by changing the examples a bit. So if we talk about, for example, misinformation about fluoride, that could be replaced with, say, misinformation about vaccines or misinformation about antibiotics or anything like that. Where I would probably start with this, definitely begin by defining kind of what is the scope of the question. So in your introduction, we talk about social media and health. Now, at that point, you can either mention something like the biopsychosocial model, so like Alicia said, and what health is actually going to refer to. Or the alternative for defining health would be using something like the WHO definition. So, kind of health is not just merely the absence of disease, but kind of having a state of complete physical, social, and psychological well being. So, what do we mean by health? Is going to be the idea of complete physical, social, and psychological well being. So, you can either use what the WHO says, or you can say that kind of according to the biopsychosocial model, to be in a state of good health, we need to have physical, social, and psychological well being. And so, when we think about the impact of social media on someone's health, we need to think about all of these dimensions. And then you go through exactly what you did, which was really nice, positives and negatives. Positives, kind of talking about information from trusted healthcare professionals, how that can help, talking about how that can maybe boost public trust in healthcare professionals, how that can improve doctor patient relationships. Then you can go on to negatives with stuff like misinformation, mental health impacts, people not feeling confident about their appearance, self esteem, all of these sort of ideas. Then you can go on to kind of confidentiality and professionalism. And then you're going to discuss kind of the risk of sharing private information, but also how kind of professionalism can be affected by use of social media, depending on what kind of things we post, but also if we end up with unprofessional interactions with patients. So, kind of, it's very important that doctors and dentists know to keep their social media profiles private, to not interact with patients on social media, to not accept friend requests. And there are a lot of dilemmas that could open up in that space that kind of is very important to be aware of in terms of what would be appropriate communications with patients. And clearly, only a professional relationship is appropriate outside of the medical context. So, in your conclusion, it would be good to mention words like health literacy to describe kind of access to health information. And it would be good to mention something like kind of social media as a tool. It is useful on the whole, provided it is used responsibly with the right safeguards. So, that's how I would approach something like this. So, thank you so much, both people. Very brave, brilliant answers. I think you guys are very, very prepared. So if we maybe leave things there and move on to a bit of an open Q&A, if anyone has any questions. And if not, thank you so, so much for coming. Feel free to leave if needed. And very best of luck for your interviews. Hope to see as many of you as possible at Birmingham very soon.
Thank you guys for coming. Yeah.
Thank you.
Let's take some questions. So, how can you integrate your reasons for why Birmingham into your answers for other questions? So it depends, right? If you've got a question about social media and health, then please, please do not start talking about why Birmingham. That will make the interviewer see that kind of you're not responding to the question, you're trying to force insert what you've prepared. So clearly a
Mhm.
bad idea. There are times when you can integrate why Birmingham, and that would be stuff like if the question asks you why medicine, and you then start talking about, say, the research side of medicine and how that appeals to you, you could then say, well, for example, I've heard about this brilliant research happening at Birmingham University that I'm really interested in, and I would love to get involved with stuff like that in the future. So, yes, in context like that, but otherwise, I would say no, kind of don't bring in why Birmingham unless the question is related to why Birmingham, why medicine, motivations. Don't do it unnaturally. Is there a calculator in the calculator station? Yes, clue in the name. Are doctors ever allowed to contact patients online? Not in any kind of outside of the professional context. So if you are kind of going through the NHS app and kind of booking an online consultation with them, then that's different. But are you ever allowed to contact them on social media? Clearly no. Whether or not they're current patients or ex-patients. How do you know which questions to make personal? Any questions that are about you, so personal attributes, work experience, motivations for medicine, why this university, they're the ones that you kind of have to make personal. The other ones you can kind of personalize in the sense, like, say it's about what do you know about the NHS? You can link that back to your work experience if you like to, with stuff like, say, overstaffing, waiting lists, but that is not an aspect that is as essential and only where it fits. So, with a question like social media and health, if you had a very good example from your own day to day life, say if you read about an article of misinformation that discusses that topic, then you could bring it up. But the ones that you absolutely have to make personal will be like personal qualities, motivations, attributes. Let's try some more Birmingham oriented questions that Birmingham students can answer. So, does it have a really high acceptance rate? Yes, it does. Right, this is a good question. So, Rima and Alicia, let's compare your Birmingham interview to any others that you did. And did you find it more fun and relaxed, or did you find it trickier? How would you compare? Rima, maybe go first.
Okay, so I personally did interviews at Liverpool, Cardiff, Leicester as well, aside from Birmingham. And I think maybe it's because Birmingham was the one that I wanted to go to. I was more stressed for the Birmingham interview, but it turned out to be one of my better interviews, only because the interviewers were so friendly. As in, I feel like I think every single station, there was some kind of conversation outside of the question. So we'd be joking around and it would be like a nice environment. Whereas some of the other interviews that I did, for example, Liverpool is quite a contrast in comparison to Birmingham, which is a lot more, it's not exactly a fun environment. It's quite a bit more, I guess, serious, as it should be. It's an interview, but I think Birmingham did it really well in the sense that you didn't feel as uncomfortable. How about Alicia? What did you think?
So I interviewed at Edinburgh, Southampton, and Newcastle as well. I think out of all of them, to be honest, I kind of enjoyed the Birmingham one the most, just because it was quite varied in the question style, and that's something that I liked. Like there weren't like two role plays. There was only one in Birmingham, and the actual questions themselves tested different skills. Um, and then the general environment, I think, at Birmingham was something that drew me to it from the interview day. Um, Most of the interviewers were really nice, apart from like maybe a couple like older doctors who were more seasoned interviewers, maybe. And the medicine students who were volunteering to help run the interviews, I found them to be really quite nice, and they gave us a tour around the medical school after as well. It kind of just felt like Birmingham would support us well. Um, my other interviews, I mean, a couple of them were online, so they were quite different, and I think online interviews are always harder, but you guys probably don't have to worry about that. Um, so yeah, I mean, it's a typical MMI style, I think, but Birmingham did challenge me, but in a way that I felt like was kind of, it was like stimulating in a way. Like it was a nice interview, I think. So
Yeah, and I think
Right.
also something about Birmingham was that you had quite a lot of time before, as in 2 minutes is a lot of time. I think most of my unis only had 1 minute. And I know 2 minutes doesn't sound like a lot of time, but when it's quiet, you can actually think a lot about your structure. And I would definitely advise in that 2 minutes to not just think about what am I going to say, but how am I going to say it? Because you don't want to just outpour your ideas in front of them when you go in, but also kind of think, okay, these are my points. Maybe I came up with like 10 points, but these two are going to give me the most depth to my answer and kind of prioritize them and think, okay, where am I going to begin? How am I going to end? And use the time wisely, I would say.
So I think in terms of Birmingham experience versus others, I got into Oxford, Imperial King's Birmingham, and kind of Birmingham was my fourth and last one. So that obviously makes things a little bit more reassuring when kind of it's doing it for the fourth time, which was nice. It was my only one that was in person at the time, with it being COVID years. And I think what was really enjoyable, kind of they really tried to put you at ease. So when you go in, they give you a tour. I can't remember if it was before or after. They might have changed it, but kind of they give you a tour of the university. They have student helpers. They give you a little talk. They try to make you feel at home, and then you go in for the interviews. So it's very much kind of they try to ease you in. They make you comfortable with the environment, and they test a variety of skills. So kind of you're being asked on everything from role play to personal qualities to math skills, and even your SJT is going to contribute to your interview score. It does mean that if you're not good at one of those things, you can quite easily compensate with others. So like for me, kind of I was always a huge fan of kind of anything data, hot topics, that side of things, not so much about talking about myself. And I felt like because I had that variety of different question types, it means that sort of whatever is the area that you excel in, you should be okay. But do kind of make sure if you've got any areas of weakness, don't neglect those. Do prioritize those as well. So I think definitely was a nice experience. Interviewers, they were all super friendly, especially the station with the student interviews. So for me, that was the data interpretation one. And they were kind of very engaged. At one point, I had a really like a new point to bring in for the data question to do with this medical condition. And they got very excited about it and they smiled. And you could see that they were kind of engaging with what I had to say, which was always brilliant to see. But equally, kind of at one of the stations, one of the interviewers was a little bit less engaged. He wasn't too smiley. So if you do have someone who is like that, don't let that put you off. Kind of interviewers can vary. And it doesn't mean that that person doesn't dislike you. It could easily be kind of just that that's what the person is like in nature. So don't let one station put you off from the others. Do expect a relatively laid back, enjoyable experience and make the most of it. It's an in-person interview. Find out what you think about the medical school as well, because hopefully a lot of you guys will be in the position where you're getting two, three, four offers, and you have to make that decision. So do you actually take it as a chance to find out about the medical school? Do you enjoy it? What do you think? And yeah, the post-interview rate is exceptional. It's higher than 70% pretty much every year. Your chances of getting an offer once you make it to interview. Slightly higher, especially for certain subgroups of applicants, depending on whether you're contextual, non-contextual. So I would say kind of you've got brilliant chances, would not be worried about that at all. Just do your best and have confidence. Were there any questions that threw me off? So we're not allowed to share specific questions because of the NDA, but kind of how you would go about answering something unexpected. I would definitely start by thinking, is there anything that I do know that I can try to bring in? And even if you don't have an idea about kind of the medical side of it, is there anything you can come up with on the spot? So say the question is about assisted dying, and you've not kind of done a lot of research into assisted dying. I mean, please do. It's a big hot topic. But suppose you're in that position, you can always try and think about things that maybe would be accessible to a layperson who's not necessarily medically experienced. And just think about very basic ideas. So, kind of what could be the benefits in terms of people not suffering? What could be maybe some of the drawbacks in terms of maybe people feeling forced into it, people are maybe taken advantage of? So, try and bring in basic ideas. The questions will usually be accessible to people from all kinds of groups, even if you've not done preparation. So it's very unlikely you'll have absolutely no clue. And if it is that sort of situation, then I would definitely ask for help. So ask the interviewer if you don't understand the question for clarification. What do you mean by this? I'm not entirely sure what this involves. Do you have any ideas? And I'm sure they'll be happy to give you a little bit of a hint, and then you answer the question. So if you've got absolutely no clue, see what you understand by it, or ask the interviewer. So say, I'm not sure what vaccine hesitancy means, but this is what I think it means. Is that right? If the interviewer says yes, then answer the question, or they might be able to help you. So that's if you've got absolutely no clue, I would ask them for some help. Let's see, for you guys, what was your prepared answer for do you have any questions? What would you have said if you got asked, do you have any questions?
I think one of mine was, what do you think makes a good medical student at this uni specifically? Um, I'm trying to remember others. I don't know if you have any more, Rima.
No, I actually wasn't asked this in my questions, I believe. But if I were, I think try not to ask too much about the course structure. Um, because surely they would expect you to at least have a basic understanding. For example, is it integrated or traditional type of teaching? Like it could send a wrong message to them. But if there's something that you wanted more detail about, for example, if there's a specific form of intercalation you want to do and you don't know as much about it, then that's, I think, a fair question to ask about because it shows that you have something that you're interested in. But also, I don't think there's anything wrong with saying you don't have any questions. So also don't feel the need to like come up with some crazy, wacky question to kind of impress them because they might already have a good impression and then you ask them a weird question and and it does more harm than good. So yeah.
So I think for me, I've done a few of these across four. I got them a couple times. Do you have any questions? There are different ways you can answer this. The first thing is, it's not a make or break question. So even if you were to say, and I've done this before, at one of them, just to say kind of thank you so much. I think we've already gone over it and you've already answered my question. So thank you for the opportunity and leave it there. That is completely fine. No one will take it against you. That's not an issue at all. The next option that I think would be quite useful is to sort of flatter your interviewer. So especially if the interviewer has told you like what specialty they do, what stage they're at, you can say, well, what you're doing today is exactly where I aspire to be in many years' time when I become a doctor. And I was wondering if you had any advice for someone who is in my position for how they can get to where you are. So that flatters the interviewer, kind of makes them feel a little bit better about themselves, which is always going to make them then feel good about you. Definitely a way to go. Could be sort of praising them. The third option could be to maybe bring up something in terms of like extracurriculars and societies to show that you're a well-rounded person. So you could potentially ask something like, I'm involved in XYZ sport. Do you know if any way that I might be able to continue with that? And that would be maybe if you struggled to demonstrate that side of things in your interview so far, you could show that you're a bit well-rounded. What I would be really, really wary of, the people taking your interviews are generally just doctors at local hospitals. They don't always teach at the medical school. They don't always know about the medical school ins and outs in terms of the curriculum. So do not ask very, very specific questions, I would say, in terms of like details of intercalation options. And if you do ask extracurricular stuff, then make sure it's in a very friendly, open-ended way, not asking specific details about the course, intercalation, extracurriculars. Because if the interviewer doesn't know, it could backfire. And definitely don't ask any scientific questions, anything like that. Because again, you don't want to show the interviewer up. If they don't know something, it's not going to end in a nice way for you. So definitely kind of ask something reasonable. Flatter them if possible. Do you have any tips for a medical student? Do you have any tips to get to where you are today? Do you know anything about like the different sort of extracurriculars available at this university? In particular, I may be interested in this side of things, but definitely be relatively open. And if you don't have any ideas, feel free to say, sorry, I'm not sure. You've already answered my questions. Thank you so much. And could you ask a random casual question like restaurant recommendations? I would say probably not. That might go along the lines of unprofessional. I think that could backfire. So maybe don't ask about restaurant recommendations. And I'll take one last question. Swayam, you don't do any sports, but you do Army Cadets, School Council, F1, St. John's Ambulance. Will that be enough extracurricular activities? So let me repeat this for any year 12s here, so you get a very good idea of what matters, what doesn't matter. No one is ever going to assess you on the number of experiences that you have, the quantity of them, especially not something like extracurriculars. So the number of experiences is never going to be significant. The only thing that's going to matter is how you can reflect on them and how you can talk about them. So all of those experiences you have, more than enough for sure. The only time that these things are going to be important, what you can say about them and what you can tell the interviewer that you've learned. So if you're answering a question about teamwork, how can you bring an example from that society about teamwork and use it to relate it back to medicine? How can you answer a scenario about communication? How can you tell people what have you learned and developed? That's the key thing. So what you wouldn't want to do is kind of collect lots and lots of experiences, but not have much to say about them. That's never the idea. And absolutely, you don't need to do sport. There are loads of ways that you can demonstrate these qualities. You could use any kind of activity you do, whether that's volunteering, whether that's music, whether that's even something totally random like tutoring, doing magic shows. Whatever you're interested in, as long as you're passionate about it and it's something that can help you to relax and that maybe you can relate back to medicine, is completely fine. So, no need to kind of do any specific sports. The stuff that you're doing is definitely sufficient. So we've already overran quite a bit. Let's probably leave things there, but very best of luck to anyone still around, and hopefully see you guys getting into medical school very soon.
Thank you so much.
Thank you guys for coming. Best of luck. Gracias. I'm not sure how to reply to that. Does anyone know? Or what's the
No,
welcome? What's the word for welcome?
no, I took German, sorry.
I took French.
Let me find out. Um, Bienvenido. Bienvenido.
Um,
Might be badly mispronounced. Is this recorded? Yes, it'll go on our YouTube. I'll share that soon. So I just move the